America vaccinated, declining numbers of people rolling up their sleeves, and the new goal set by the Biden administration. Hi, I'm Dave Elliott. Thanks for joining me, and we're going to start with the battle to get more Americans vaccinated. Joining us, a doctor right there on the front lines, has been for some time now, Dr. Johnathan Baktari. Dr. Baktari, good to have you here in coastal Mississippi. Thanks for joining us.
Yeah, thanks for having me.
Let's start with the raw numbers. 248 million doses administered. That as of Friday, 106 million people fully vaccinated. That represents about 34% of the adult population. At this point in the story, is that about what you expected, or do you find that a bit disappointing?
I know that's about what we expected, given when the vaccine, originally rolled out in last December, and then getting the volume of vaccine in terms of manufacturing. And, if you look at 1/3 of the population being vaccinated, and if you assume another 1/3 of the population got the disease, so that's why people are optimistic we're rolling towards herd immunity if we don't have any curveballs thrown at us.
Now, the Biden administration set that goal to get at least 70% of adult Americans vaccinated by July 4th. I think we've realized that vaccine hesitancy is a very real thing. Do you think that goal is achievable? And if you were to be behind a campaign to try for public awareness and education and reach Americans, how would you do it?
Well, a couple things I would add to that. First of all, I think both Pfizer and Moderna are very close to announcing 12 to 15 and 12 to 17-year-old approval for their vaccines pretty imminently. That actually will get to a population that may not be hesitant, just has not been able to get it. So that's going to certainly have an immediate kind of bump in the numbers. But in terms of the vaccine hesitancy, I think what the case we need to make is, if we assume 1/3 of Americans already got the disease, it's not like if you don't get the vaccine, there's a good chance you won't get the disease. There's a very good chance you'll get COVID if you don't get the vaccine, given the fact that, like I said, 1/3 of Americans have probably already done it anyway.
There are a lot of questions about after being vaccinated and how that impacts things like mask wearing and social distancing and behavior, whether it be indoors, outdoors. Do you think we're getting mixed messages on that? And do you think that's a bit of a problem?
Well, I think the mixed messages we're getting is because sometimes there's the right answer from a public health point of view, and sometimes there's the right answer on an individual basis. Individually, once you're vaccinated, there might be an argument for relaxing mask wearing. But if you do it on a mass level from a public health point of view, because you can't really differentiate people walking outside who didn't or got the vaccine or didn't get the vaccine. So sometimes we make public health policy for the good of everyone, but individually it might not make as much sense.
Some news this week that most Americans probably didn't want to hear. Moderna's president came out and said a booster shot will likely be needed every 9 to 12 months. A, do you agree with that? B, is that because of the variants? C, do you think Americans are going to accept that?
Well, I think they were talking about rolling it up potentially in the flu shot, so you get it simultaneously. Is I think where they were going with that. But it all, that jury is still out, because some of the variants, to vaccines that were produced outside the U.S., like the AstraZeneca, have shown not to be, super effective, like the variant in South Africa. But with the 3 we have approved in the United States, 3 COVID vaccines, we haven't seen the variants, not work with those vaccines. So until that happens, we can be hopeful. But yes, if any of those variants that come out are not will not work against the current 3 vaccines we have, we might be looking for a booster. And that's when a booster would come in, when a variant is better than the vaccines that we have currently.
Everybody's been reading the horrifying headlines from India.
Yes.
And we've banned travel to and from India as a result of that.
Right.
What are your thoughts on the future of kind of international travel, and the suggestion that a vaccine passport might be in the works, possibly even for domestic flights within the U.S.?
Well, I'm not sure that makes a whole lot of sense in the sense that, vaccine passports, traditionally, like we see for yellow fever, is really not meant to protect the person with the passport. We're assuming the person who could get the passport is protected. It's really meant to protect the environment they're going into. So if relatively most of the United States is safe, let's say come July, and we are close to herd immunity, that wouldn't be an issue. But really the use of a vaccine passport is really meant to keep the people safe who that person is coming into contact with. So if we've gotten to herd immunity, that the need will get less and less for a vaccine passport if we can get there.
This is something that, again, a lot of the things we're talking about, there's the medical side of it and then there's the policy side of it. But expanding a little bit beyond that vaccine passport, what do you think about, do you expect to see companies requiring employees to be vaccinated? Do you expect stores like retail and restaurant to require employees and customers to flash that card or even have a barcode of some kind on their iPhone just simply to live their lives?
Yeah, I doubt it'll come to that, but I mean, certainly on some level that already exists. If you want to get a job in a hospital or a nursing home today, you have to prove you've gotten a whole host of vaccines. That precedent already exists for certain jobs. Whether we're going to need it for general use or going to a hockey game or football game or places where there's large crowds, that potentially I could see. And but for an employer, they would definitely have to prove that the employee coming in poses a hazard to other employees, and that they don't have herd immunity essentially within that area. So it could happen, but again, the closer we get to the majority of the population either having the disease or having the vaccine, the less necessary that is, unless you can, like in a hospital setting, take no chances at all where an employee might hurt a patient. So if there's a situation where your employer might hurt someone, then yes, but practically speaking, herd immunity should address a lot of that.
Here in Mississippi and around the country, for the most part, with the exception of Michigan and a couple of other states, positive case numbers, that 7-day average has really plummeted over the last 6 weeks or so. Hospitalizations here in our state have also stabilized, and that was always the biggest concern all along. What's your message to people who look at those numbers and say, hey, we're out of the woods?
Well, I mean, we're out of the woods in terms of the fact that the most vulnerable the majority of the most vulnerable have already been vaccinated. So, certainly more than 2/3 of everyone above 65 has been vaccinated. Those were the people that predominantly were getting sick and going to the hospital. So yes, that's anticipated, predicted. When you vaccinate the most vulnerable first and the most at risk first, you should see a drop in deaths and hospitalization. But we're still getting 40, 50,000 new cases a day, and we're still having deaths every day. So I think the numbers going down initially is simply a reflection of we've taken a lot of the people at risk out of the equation, but we haven't taken everybody out of the equation.
Okay, just about 30 seconds left, Dr. Baktari. I think from the very beginning, the CDC, World Health Organization, many others have been pretty inconsistent with whether it's the mask wearing or anything else. But again, we're taking this day by day. I think we're learning something every day. I think you agree with that. Do you think that has been a problem in terms of public confidence?
Yeah, I think the mixed messaging, and I think early on, I think it was unclear the degree and the mode of transmission for the SARS-CoV-2 virus. I think the fact that it's now pretty clear to everybody that it's spread by aerosol, spread from either talking or laughing or being near someone who is just you're having a conversation with. Once you realize that's a risk, then all of a sudden the mask thing becomes more obvious.
Dr. Johnathan Baktari from Las Vegas, here in South Mississippi. Thanks for being with us, Doctor.
It's a pleasure. Thank you for having me.
Well,